It was very important to me as a resident of this community since 2006 and experiencing both professionally and personally firsthand the struggles, the mental health struggles of children, adolescents, as well as adults in this community. Certainly, we know that suicide rates have increased dramatically in this county in particular. It's up around 83% in the last decade. We know with COVID and even prior to COVID, we really have a mental health crisis in our country. So it was very important to me to be able to stand up a program that could help meet the mental health needs of this community.
The demand for services has been so great, particularly in light of the past year with the pandemic. According to the CDC, over 40% of adults last year were reporting an increase in mental health issues and substance use concerns. And so we really want to be able to be a resource to our community and bridge the gap between higher levels of care, the need for acute psychiatric stabilization, and just outpatient care. In Pathlight Mood and Anxiety Center of the Woodlands, we provide partial hospital programming, which is a day treatment program, as well as intensive outpatient programming, which is a less intensive level of care. For the partial hospital day treatment program, we provide 7 hours a day of treatment, Monday through Friday, and then 6 hours on Saturday and Sunday. And for the IOP program, that's 3 hours with 3 days a week.
We have a great deal of family therapy and family support, family involvement, as well as aftercare available. So we're really starting the process for individuals here with us with our treatment model and continue to provide support for them from here on out in their recovery process. For our adolescents, we know that many of the adolescents, as well as their families, are very concerned with school.
At Pathlight here in the Woodlands, we have what we call an education specialist who's both educated in counseling and in academia and can support our adolescent patients in continuing their schoolwork so that they don't have to choose between continuing school and getting well.
Here at Pathlight, we have a full-time psychiatric nurse practitioner on board, and that's a little bit different from other treatment facilities in the Houston and Woodlands area. A lot of times they have to bring in contract staff, and at this facility, I'm here, I'm a dedicated employee that wants to work with you and your family and get to know you well, and I'm always going to be there.
We are very excited about our Pathlight Mood and Anxiety space. It is a very serene environment. We overlook a water feature on one side with trees all around. We have a butterfly garden that's on the other side of our building. We have lots of natural light. We feel like it's important for individuals who are struggling with different types of mental health challenges to have a serene, calming environment in which they can begin their healing process. So we think that we've mastered that with this beautiful new space.
I think patients and families will find our space very welcoming. We have a mindful walking path outside when it's time for fresh air breaks, and it's just a really, really nice space in which to recover.
Pathlight Mood and Anxiety Center is located in the Woodlands, Texas, in Montgomery County. However, we are right off the interstate and easily accessible to the greater Houston metro area, as well as to our neighbors to the north, the west, and the east.
We know that mental illness does not discriminate, and neither do we. At Pathlight, we treat everyone. We accept patients from all demographics, from all races, genders, orientations. We treat patients starting from age 12 and up. So we have 2 separate milieus with an adolescent-focused program. This is 12 to 18 for those that are still in high school, and then an adult program, ages 18 and up. They do programs separately so that our adolescents are not commingling with our adults.
Here at Pathlight Mood Anxiety Center, we treat a combination of different mood disorders, major depression, bipolar disorder, other mood disorders, the different anxiety disorders and trauma-related disorders such as post-traumatic stress disorder. We will have a specialized obsessive-compulsive disorder track, and again, specialized trauma care as well for the individuals whom we work with.
So at Pathlight, the transdiagnostic approach means that we're treating the patient and the whole person, whatever they may bring in. So we're going to approach this in a variety of different ways and make treatment unique to them. So not everyone is receiving this exact same type of care. So what works for someone may not work for the next person, and we recognize that. We're able to adapt to each person's individual needs and respond accordingly with interventions that will work well with them. So with that, we'll provide a variety of different modalities, including dialectical behavior therapy, cognitive behavioral therapy, exposure response prevention.
Transdiagnostic approach is using approaches that can span across different disorders using those commonalities of what individuals need. So we use those evidence-based therapies in addition to an individualized treatment program to again equip the patients that are with us, their families, as well as their support system with the skills that they need while they're with us, and then certainly beyond, including a great aftercare program and support groups that are available to all of our alumni and family indefinitely. I'd like the providers to know that we consider you an essential partner, and we want to continue to partner with you in the treatment of your patient and your family. So what you can expect from us is that we will be in close contact with you, and in whatever shape or form you prefer, in whatever frequency that you prefer throughout this process. Again, we are here in this community to provide extra support, extra structure to our community providers and to partner with them in the health and the care of their patients. On the flip side, we do have individuals that come into our care that do not have an outpatient community team. And so by having so many wonderful community providers with whom we partner, we can then refer the people that come to us in need of a community team.
I like to work with treatment providers because I want to hear their perspective on our patients that come in. They have a lot to add to the treatment of the patients, and we want to get their perspectives, and then we want to follow up with them as well after treatment and work very closely and collaborate with them.
Providers should know that when they are entrusting us here at Pathlight with the care of their patient, that they are going to be informed and communicated with every step of the way. Our clinicians are going to be reaching out to you and coordinating care with you weekly or on a frequency that meets your needs.